future of Obamacare hanging in the balance, the president's signature legislation at risk of being dismantled when President-elect Trump takes office.
We're working with the majorities in the House and Senate to move forward an aggressive agenda. Decisions have been made that by the president-elect that he wants to focus out of the gate on repealing Obamacare and beginning the process of replacing Obamacare with the kind of free market solutions that he campaigned on.
This coming as the new Reuters poll shows 21% of Americans want the president-elect to focus on health care first, ahead of both jobs and immigration. Joining us right now is the CEO and president of the Cleveland Clinic, Dr. Toby Cosgrove. Toby, great to see you. Thank you so much for joining us.
Good morning.
Let me ask you your thoughts on this. What kind of changes would you like to see from Obamacare as the president-elect digs in now on this?
Well, I think one of the things you have to understand about health care is it's an incredibly complex industry. It's the biggest industry in the United States, affecting 100% of the individuals in the United States, and it's going to take some time to think about how we can improve the Obamacare or the Affordable Care Act. I think one of the things we have to realize is we have to put more emphasis on keeping people well if we're going to control the cost of health care, and we need to think about how we can control the cost across the entire country. Only two ways really to do that. One, more efficient delivery system for people who are sick, and secondly, to keep people well.
Let's talk about that, because that's the big issue here, right? The cost of it. Because when you
Absolutely.
speak with small business, even mid-cap business, large business, this is the biggest expense. And one of the reasons that they're not creating more jobs, not investing in their business.
Exactly.
I mean, you've been focused on wellness since I know you, years. But
Yes.
the delivery system, in terms of delivering it at better prices, how do you do it, Toby?
Well, I think the delivery system has to recognize that we have to take cost out, and we have to do it through efficiency. One of the things that healthcare is doing across the country is hospitals are consolidating. It's really the last industry in the United States that hasn't consolidated, and there has to be some consistency in Washington between the Justice Department and the Congress in order to allow this to happen. The Justice Department has really prevented a lot of the consolidation from happening. The consolidation will allow us to purchase things better. It will avoid duplication of services. And really, I think in most cases where you see that up to 60% of our costs are fixed by a government, it's not going to raise prices substantially.
So there's too much capacity then in the hospital space still. We still need to see consolidation in the hospital space.
Well, no question about it. Hospital occupancy across the United States is about 65%. For example, in Ohio, we have 202 hospitals across the state. Now, one of the concerns is right now is with the decreasing payment that our hospitals are getting for the services they provide, we're seeing almost a quarter of the hospitals now running in the red. So ultimately, if we do not see consolidation and increased efficiency, we're going to see hospital closures across the country.
Let me get your take on what Kathleen Sebelius and Governor Mike Leavitt told me yesterday on Sunday Morning Futures. Both are former secretaries of the Health and Human Services Office. They said change needs to be made. Watch this.
Frankly, there are some system needs that need to be changed, and I think the Republicans have made it very clear for 3 election cycles in a row that they want significant changes to be made, and I think it's clear from the outcome of this election that the people want that as well.
Most Americans feel everyone should have health care. Most Americans feel costs are too high, and I'm eager to see what is the proposal to make sure that 20 million people who now have insurance coverage don't lose it.
Can you lower the costs, Dr. Cosgrove, as you say, through delivery, through wellness, but also ensure that those 20 million who have it keep it?
Well, I think we have to continue to keep those people covered. Otherwise, the promise for hospitals of more patients, even though we're being paid less, is going to cause more and more hospitals to have major economic problems. So yes, we need to continue to cover those individuals. The question is really how do we do it and how we do it most efficiently.
I had a feisty conversation, to say the least, last week with Jonathan Gruber, one of the architects of Obamacare, and he said that there was no relation to economic growth. Obamacare, the Affordable Care Act, has nothing to do with economic growth. Listen to this, Toby. Got to get your take.
You made up the fact that Obamacare has caused job loss. There is no evidence. You made up the fact that
There's 100%
no, there is
evidence.
none. There is Maria,
all I need
Maria,
are 10 CEOs to come on this show and tell me that's the reason, and then it becomes
okay,
fact.
who cares if some CEO comes on the show and tells you that's the reason? Look at the data, Maria. You used the word data. Look at the data. There is not a single data point.
I don't need data when I have the CEO telling me I'm not adding workers because of the cost of Obamacare. That is my data. Dr. Cosgrove, what about that? I mean, when you speak to businesses, they continue to point to the healthcare costs as a reason for taking, you know, full-time jobs to part-time jobs and not adding more jobs, frankly. What's your take?
I don't think there's any question that the industry and leaders have been forced to be concerned about how many employees they have on the basis of the cost. It is an enormous cost to manage it. However, I will point out that you can begin to decrease the inflation rate of health care if you look at it and manage it. And I think that's one of the challenges that I would throw out to the private industry. Begin to look at how you manage your employees and with wellness and with disease management. And we have taken the inflation rate for our employees from 7.5% 10 years ago to -2% last year.
Right.
And so you can make a substantial difference, and that has resulted in not increasing the insurance for our employees. They're not costing any more this year than they did last year.
Well, the other thing is that there isn't a lot of choice. I mean, we thought there was going to be all this choice, and now one by one, each insurance companies are saying, I'm not going to be there. United Health says it's going to lose $1 billion. It pulls out of the exchanges. And now this morning, one of the top stories in the Journal, as you know, Toby, Anthem, defending its planned $48 billion deal for Cigna after the Justice Department challenged that. So we know that consolidation has to come for the hospitals, but where are you in the insurance companies? Because a lot of these insurance mergers are being stopped by the Justice Department. Is that appropriate?
Well, I think we're going to see consolidation across the insurance industry. I think we're going to see it across the pharmaceutical industry. I think we're going to see it across devices. And I think we're going to see it amongst the hospital providers. And this is what is the response to the demands to have more efficiency in our healthcare delivery system. There's no question that if the insurance industry consolidates, we're going to have to consolidate as providers to negotiate with them.
Well, we'll see if Anthem is successful with this deal with Cigna. Toby, always a pleasure. Thanks so much.
My pleasure. Thank you, Maria.
We appreciate it. Dr. Toby Cosgrove joining us there.